Assalamu alaikum, dear guys. Hope that all of you are fine. Here, I'm a clinical psychologist, UMM-E-HABIBA. Today, we talk about a disease which is related to your brain. That's name is Parkinson's disease. Firstly, we have to know what is Parkinson's disease. Parkinson's disease is a progressive disorder that affects the nervous system and the part of the body controlled by the nerves. Symptoms start slowly. The first symptoms may be a barely noticeable tremor in just one hand. Tremors are common, but the disorder also may cause stiffness or slowing the movement. In the early stages of Parkinson's disease, your face may show little or no expression. Your arms may not show any swing when you walk. Your speech may become soft or slurred. Parkinson's disease symptoms worsen as your condition progresses over time. Although Parkinson's disease can't be cured, medicines might significantly improve your symptoms, but occasionally a healthcare professional may suggest surgery to regulate certain regions of your brain and improve your symptoms. Let us discuss some symptoms of Parkinson's disease. Parkinson's disease symptoms can be different for everyone. Early symptoms may be mild or go unnoticed. Symptoms often begin on one side of the body and usually remain worse on that side. Even after symptoms begin to affect the limbs on both of your sides. Parkinson symptoms may include like tremor. It's a rhythmic shaking called tremor, usually begins in a limb, often your hand or fingers. You may rub your thumb and forefinger back and forth. This is known as a pill rolling tremor. Your hand may tremble when it's at rest. The shaking may decrease when you are performing tasks. Also, it involves slowed movement, known as Kinesia. Over time, Parkinson's disease may also show slow your movement, making simple tasks difficult and very time consuming. Your step may become shorter when you walk, and it may be difficult to get out of a chair. You may drag or shuffle your feet as you try to walk. Also, it include rigid muscles. Muscle stiffness may occur in any part of your body. The stiff muscle can be painful or it may be limited your range of emotion. Also, it also cause impaired posture and your balance. Your posture may become stopped or you may fall or have balance problem as a result of Parkinson's disease. Also lose your automatic movements. You may have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. Also, you have a difference in your speech changes. You may speak softly and quickly, slur or hesitate before talking. Your speech may be more of a monotone rather than have the usual speech or pattern. Also face writing changes. It may become hard to write and your writing may appear small. Now we are moving toward the causes of Parkinson's disease. It's certain nerve cells called neurons in the brain gradually break down or die. Many of the symptoms of Parkinson's are due to the loss of neurons that produce a chemical messenger in your brain called dopamine. When dopamine level decrease, it cause irregular brain activity and it also leading to problem with movements and other symptoms of Parkinson's disease. The cause of Parkinson's disease is unknown, but there are several factors that appear to be play a role like including genes. Researchers have identified specific gene or genetic change that can cause Parkinson's disease. But these are unknown aspects in rare cases with many family members affected by Parkinson's disease. However, there are certain genes variation appear to increase the rate or risk of Parkinson's disease. but with a relatively small risk of Parkinson's disease of each of these genetic makers. Also, it include environmental factors. Exposure to certain toxins or environmental factor may increase the risk of later Parkinson's disease, but the risk is small. If we talk about the risk factors in Parkinson's disease, it include age, heredity, also the sex. About age, young adults rarely experience Parkinson's disease. It ordinarily begins in middle or late life. And the risk of Parkinson's disease is increased with age. People usually develop the disease around age 60 or older. If a young person does have Parkinson's disease, genetic counseling might be helpful in making family planning decisions. Work, social situations, and medicine side effects are also different from those of an older person with Parkinson's disease and require special consideration. And about heredity, having a close relative with Parkinson's disease increase the chance that you will develop the disease. However, your risks are still small unless you have many relatives in your family with Parkinson's disease. And about sex, men are more likely to be develop Parkinson's disease than a woman. Also, the ongoing exposure to herbicides or pesticides may slightly increase your risk of Parkinson's disease. During Parkinson's disease, patient may face many complications like thinking difficulties. You may experience cognitive problem like dementia and thinking difficulties. These usually occur in the later stages of Parkinson's disease. Such cognitive problems are not usually helped by medicine. You may experience depression sometimes in the very early ages or stages. Receiving treatment for depression can make it easier to handle the other challenges of Parkinson's disease. And in this, you may also experience other emotional changes like such as fear, anxiety, loss of motivation. You may also develop difficulties with swallowing as your condition progresses. Saliva may accumulate in your mouth due to slowed swallowing, and also it's lead to drooling. Late stage Parkinson's disease affects the muscles in the mouth, making chewing difficult. This can lead to choking and poor nutrition. People with Parkinson's disease often have sleep problems, including waking up frequently throughout the night, waking up early, or falling asleep during the day. People also may experience rapid eye movement, sleep behavior disorder, which involve acting out dreams. Also, Parkinson's disease may cause bladder problems, including being unable to control urine and or having difficulty in urinating. Many people with Parkinson's disease develop constipation mainly due to a slower digestive tract. You may also experience blood pressure changes. You may feel dizzy or lightheaded when you stand due to a sudden drop in blood pressure. Also, you may experience problem with your sense of smell. You may have trouble identifying certain odors or the difference between the odors. Many people with Parkinson's disease lose their energy and experience fatigue, especially later in the day. The cause is not always known because some people with Parkinson's disease experience pain either in specific area of their bodies or throughout their bodies. Some people with Parkinson's disease notice a decrease in sexual desire or performance. At last, we talk about the prevention from Parkinson's disease. Because the cause of Parkinson is unknown, there is no proven ways to prevent the disease. Some research has shown that regular aerobic exercise might reduce the risk of Parkinson's disease. Some other researches has shown that people who consume caffeine, which is found in coffee, tea, and cola, get Parkinson's disease less often than those who don't drink it. Green tea also is related to a reduced risk of developing Parkinson's disease. However, it is still not now whether caffeine protect against getting Parkinson's disease or is related in some other way. Currently, there is not enough evidence to suggest that drinking caffeinated beverages protect against Parkinson's disease. So it's all about today. Let us talk in another video. Kindly subscribe my channel for more informative video.